Hello everyone, welcome to my YouTube channel, Dr.shil's Physio Victory. Today I will discuss about some questions previous year GSSSB 2020. Let's start. Today's first question: which type of force results in spiral fracture? Option A, bending force. Option B, twisting force. Option C, straight pulling force. Option D, crushing force. Here, the correct answer is option B, twisting force. Actually, a spiral fracture is also known as torsion fracture, also known as torsion fracture. It occurs when a bone is subjected to a rotational or twisting force along its long axis. Okay, and for bending force typically leads to transverse or oblique fracture. Straight pulling force basically causes avulsion and crushing force or compression results in burst fracture or compression fracture. Burst or compression fracture. Next, come to question number 2. Following electrotherapeutic agent will not be chosen in case of metal in the tissues. Option A, microwave diathermy. Option B, cold packs. Option C, hot packs. Option D, contrast bath. Here, the correct answer is option A, microwave diathermy. Microwave diathermy basically uses electromagnetic waves to generate deep heat, but it is contraindicated in patients with metal implants, pacemakers, or foreign bodies because the metal can absorb and concentrate energy leading to burn or tissue damage. Next, come to question number 3. Impairment is defined as option A, loss of psychological, physiological, or anatomical structure or function in a human being. Option B, lack of ability to perform an activity considered normal. Option C, inability to perform family and social role. Option D, all of the above. Here, the correct answer is very easy according to the definition. Loss of psychological, physiological, or anatomical structure or function loss is called impairment. Lack of ability to perform an activity considered normal. Uh, this is called basically uh, disability. And option C is basically referred as um, handicap or participation restriction. Next, come to question number 4. The progression of E2 dose in UVR therapy is option A 25%, option B 50%, option C 75%. Sympathetic dystrophy in acute stage except option A pitiable gross edema, option B, severe pain, option C, color change, and option D, stiffness. Here, the correct answer is option D, because stiffness is not a part of RSD. RSD is also known as complex regional syndrome type 1. There is, we can see irritable gross edema, severe pain, and color change. So, next, come to question number 6. Which one of these tests is not used for balance test? Option A, work balance test. Option B, performance oriented mobility assessment. Option C, functional independent measure. Option D, time up and go test. It is also called tug test. Here the correct answer is option C, functional independent measure. Functional independent measure basically assesses overall activities of daily life. Overall activity of daily life. So others, work balance test, performance oriented mobility, and time up and go test are basically used for balance testing. UMA. Next, come to question number 7. The rate pressure production is linearly correlated with option A, pacing of heart, option B, myocardial O2 demand, option C, cardiac diastole, option D, none of the above. Basically, uh, rate pressure production or RPP is calculated as heart rate into systolic blood pressure, and basically RPP serves as a non-invasive estimated uh, myocardial oxygen consumption. Non-invasive measure of myocardial O2 consumption. So the correct answer is option B, myocardial O2 demand. Next, come to question number 8. Identify the basic gait determinants. Option A, arm swing. Option B, shoulder rotation. Option C, pelvic rotation. Option D, trunk flexion and extension. Basically, there is 6 determinants of gait. One is pelvic rotation, pelvic tilt, stance, phase, knee flexion, 4, foot and ankle mechanism, 5, knee mechanisms, and option 6 is lateral pelvic displacement. Here the correct answer is pelvic rotation. Next, come to question number 9. Positive autolearning sign is present in option A, CDH, option B, CTV, option C, ARBS palsy, option D, arthrogryposis. Here, the clear answer is CDH, autolearning Burley's test are basically used for CDH. Next, come to question number 10. Gender, age, education, and lifestyle are example of which ICF component? Option A, contextual factor. Option B, personal factors. Option C, environmental factors. Option D, universal factors. Here, the correct answer is option B, personal factor. Basically, ICF is divided into two parts. One is functioning and disability, and two is contextual factors. Now, this functioning and disability is divided into two parts. One is body functions and structures, and two is activities and participation. And in contextual factor, there is also two things. One is environmental factor, and other thing is personal. In personal factor, there is age, gender, education, and in environmental thing, there is physical environment, social environment, and policies. And in body function and structures are organs, limbs, and in activity participations, limitation and restrictions occurs basically. Next, come to question number 11. Which heart sound is associated with AV valve closure? Option A S1, option B S2, option 3, option C S3, option D S4. Atrioventricular valve closure is option A S1. S1, which is also called lub, results from closure of mitral and tricuspid valve, or called atrioventricular valve. S2 is dub, which is from aortic and pulmonic or semilunar valve closure. S3 and S4 are extra sound related to ventricular filling. Next, come to question number 12. In child, center of gravity is at level of option A T6, option B L5, option C T12, option D S2. Here the correct answer is option C T12. Sorry, T12, because in children the center of gravity is higher than in adult due to proportionally larger hands and shorter limbs. S2 for adults. In infants, basically T6 are allowed in infants. Next, come to question number 13. Best iron for anatophoresis for adherent scar. Options are option A magnesium, option B copper, option C zinc, option D chloride. Here the correct answer is chloride. Chloride ion form sodium chloride are used in anatophoresis to soften the adherent scar. Magnesium actually relaxes muscles. Copper is antimicrobial and zinc is for healing. Next, come to question number 14. Blister formation in thermal injury implies depth of burn. Option A superficial, option B superficial dermal, option C deep dermal, option D full thickness. Here the correct answer is option B superficial, dermal, or partial thickness, or full thickness is destruction of destroys all layers, deep dermal or deep partial uh, dermis involves dermis is superficial or first degree or first degree only affect the epidermis, affect dermis. Next come to question number 15, which is not component of tetralogy of Fallot. Option A VSD, option B ASD, option C pulmonary stenosis, option D right ventricular hypertrophy. Tetralogy of Fallot includes ventricular septal defect, or VSD, pulmonary stenosis, and overriding of aorta, and right ventricular fluid. ASD or atrial septal defect is not a part of tetralogy of Fallot. So here the correct answer is option B. Next come to question number 16. Lesion affecting anterior horn cell and peripheral nerves is called option A UMN syndrome, option B LMN syndrome, option C both, option D none of the above. Here the correct answer is LMN syndrome. In LMN or lower motor neuron syndrome, basically anterior horn cell and peripheral nerves are involved, and in UMN or upper motor nerve above the anterior horn cell or the central part of the corticospinal tract. Next come to question number 17. Borg scale 13 represents option A light, option B somewhat hard, option C hard, and option D very hard. Borg scale or RP Borg scale six to 20 points. Light is basically 9 to 11 is light. Somewhat hard is basically 13. Hard is basically 15. And very hard is 17. So our correct answer is option B somewhat hard. Next Come to question number 18. Training principle extension of Wolff's law. Basically, they ask that which training principle is extension of Wolff's law. Option A, overload. Option B, SAID. Option C, reversibility. Option D, overflow. Here the correct answer is option A, overload or overload principle. Overload principle is the extension of Wolff's law. Wolff's law found by Julius Wolff in 19th century. Basically, he states that bone adaptation to the mechanical load or stress placed upon it. In the context of exercise physiology and training principle, Wolff's law is directly extension through the principle of overload, also called the progressive overload. SAID principle is specific adaptation to imposed demand, or reversibility and reversibility principle is use it or lose it. Overflow is cross training. Basically, there is no principle like overflow. Exercises principles are only three: training principle, overload principle, SAID principle, and reversibility principle. Next, come to question number 19. Law stating EM or electromagnetic waves must be absorbed to affect tissues. Option A, Joule's law. Option B, Grother's law. Option C, Snell's law. Option D, none of the above. So here the correct answer is Grother's law. Grother's law states that photochemical effects require absorption of light and energy. Photochemical effects require absorption of light energy. Joule's law is heat from the current. And Snell's law basically refraction. Next, come to question number 20. Outcome measure measuring what it intended is called. Option A, stability. Option B, reliability. Option C, validity. Option D, suitability. Here the correct answer is option C. Validity ensures a tool measure to intended construct. Example, content, criterion, and validity. Stability is test, retest, reliability basically is consistency, and suitability is appropriateness. Next, come to question number 21. Heel strike of one foot to opposite foot is called option A step width, option B stride width, option C step length, option D stride length. Here it's very easy question. Option C step length. So heel strike of one foot to heel strike of another foot, this distance is called step length, and heel strike of one foot to heel strike of the same foot is called stride length. Step width is basically distance between 2 feet. It is next come to question number 22. Prone knee flexed 90 degree with tibial rotation test. Option A McMurray, option B Latchman, option C Apley, and option D Clark. Here the correct answer is option C Apley's test or Apley's grinding test for meniscus. Latchman is for ACL. McMurray is for spine, and Clark's test is for patellofemoral. Next, come to question number 23. Loss of axonal continuity with intact connective tissue. Option A neuropraxia, option B axonotemesis, option C neurotemesis, option D neurolysis. Here the correct answer is option B axonotemesis. Next, come to question number 24. Muscle fiber with highest fatigue resistance. Option A type 1, option B type 2A, option C type 2B, option D type 1A. Here the correct answer is type 1. Type 1 is slow twitch oxidative muscle fibers or aerobic fibers rich in mitochondria and mitochondrial myoglobin, highly fatigue resistant. These are postural muscles. Type 2A is fast oxidative type 2B is fast glycolytic, and there is nothing called type 1A. Next, come to question number 25. Romberg test standing time. Option A 10 to 20 count, option B 20 to 30 count, option C 10 to 20 seconds, option D 20 to 30 seconds. Here the correct answer is option D 20 to 30 seconds. Romberg test basically assesses proprioception and vestibular function, first with eyes open, then eyes closed, stand feet together for 20 to 30 seconds. If the patient is unable to stand, then it is called sensory ataxia. Thank you everyone. Please do like, subscribe and comment, and stay tuned for my upcoming videos.